Good morning, everyone. Oh, thank you. Bonjour. Bonjour à tous. For those of you who don't know me, my name is Sheila Maloney. I'm Executive VP here at Canada Health Infoway. Et c'est un grand plaisir pour moi de vous souhaiter la bienvenue à la conférence partenariat 2018 à Montréal.
Great pleasure to welcome you at this 2018 conference in Montreal. Welcome to all.
And we're looking forward to a wonderful day and a half. Montreal, it's such a great city, and we always love coming here. And I think everybody loves coming here. We have record attendance for this partnership conference. We have, at 9:45 last night, I was still getting emails saying they still keep coming in. We're at 382 registered for the conference this year, which is a record for us and surpasses the numbers by far. So thank you for coming to Montreal, and we're looking forward to a next couple of days. I also want to acknowledge the 200 people who are joining us by webcast. So welcome, and we really appreciate you coming to us. We've got a great program here today. And it's my job I'll be emceeing over the next couple of days, and we're really pleased. I've got a number of things that I'm going to run through, so we'll do that and get you on our way, and we'll get started. One of the questions that somebody asked me yesterday is who's all coming to partnership, and the answer is everybody. As I said, record attendance this year. Nous avons des personnes de toutes les régions du pays. We've got people like a strong.
Tout le monde, everybody. We have a big contingent from Western Canada. How many?
Welcome. Thank you for coming. Yeah. How many here are at partnership for the first time? First time attendees? Awesome. Great. And so everyone else has been here before and knows the drill, so we're really pleased. On a des représentants de la province de Québec.
For those who are from Quebec, we're quite happy to greet you today.
A lot of First Nations, patients included in the conference program. We'll talk about them a little bit sooner. What we want to do, though, is before we start, we really want to acknowledge the land that we are on. We are on the sacred territory of the St. Lawrence Iroquois, the Mohawk, and the Mohawk-Wendat First Nations. And so we want to acknowledge the Western Montreal on their lands, and we're grateful for the opportunity to work on these lands. I should also say that this is Digital Health Week, so happy Digital Health Week to everybody. This is the 5th year that we're doing Digital Health Week. And, for those of us in the industry, we know there's lots of things lots of challenges and lots of opportunities to improve the digital health services in Canada. But there's lots to celebrate as well. And so we've been celebrating Digital Health Week for the past 5 years. And we've got over 70 participating organizations who lend their hand, who are helping us celebrate Digital Health Week. The Canadian Medical Association, the Canadian Nursing Informatics Association, Patients for Patient Safety, Patients Canada, a number of disease-specific groups, Arthritis Society, Diabetes Canada, ITAC Health. So thank you for all who are participating. If you are tweeting and want to help us celebrate Digital Health Week, the hashtag #ThinkDigitalHealth is the hashtag that we're using. Pensez santé numérique, pensez avec un Z en français. If you're tweeting, we will be live tweeting from the conference as well. So happy Digital Health Week, and thank you for helping us celebrate that. The next slide is around our Patients Included. So again, for the 3rd year in a row, we are very pleased to be Patients Included. That's a certification that we receive, and what that means is that we have included patients in every aspect of the program. We have patient advisors who helped us plan the program. And you'll see here Robert Bloom, Jessica Havens, and Priscille Sanon, who have helped us, as I said, help us plan the program. We have patients who are participating as panelists, as presenters, as moderators, and so we're very pleased. We've had some Facebook live chats that we're doing with our patients this year. We've got some podcasts, lots of going on, so appreciate them participating. Thank you, yes. We really, the patients do change the voice of the conversation. And for those of you, how many were at the screening last night of Falling Through the Cracks, Greg Price, or who have seen the film before? We had standing room only last night. And this, if you haven't seen it, Greg Price was a young man who had a journey with cancer. And the docudrama Falling Through the Cracks tracks his 407 days through his healthcare journey. And I think Falling Through the Cracks is an appropriate title for the film. There are a number of times when Greg, his care was, or his journey was suboptimal. And so if you haven't seen the film, I promise you, and don't take my word for it, ask anybody who has seen it. This film is very impactful, and it's a tremendous credit to the patient voice, and it really talks to, and I think Dave Price said it really well last night, he talked about the team and the healthcare team, of which a patient is a part. And every person on that team is an expert in a certain area, and so the patient's expertise has to be respected and heard as well. And so I would strongly encourage you, if you haven't seen that film. And we are doing an online webcast screening of that, national screening, Thursday, from 8:30 to 10 p.m. Eastern Standard Time, Thursday evening, November 15th. So if you haven't caught it, please, I would encourage you to do so. Let me say that, and you know, the other thing I should mention in terms of the patient advisors, we put out an application, sort of a call for people who are interested in doing this, and we can only, pick a handful, but we had over 150 people apply for that patient advisor position. So I think it's a testament to how important the patient voice is and how much they want to contribute to these conversations, how important it is for them to contribute to these conversations as well. Two quick other things to do. We have some welcoming remarks from our Federal Minister of Health, Madame Jeanette Petitpas-Taylor. We're going to show her video, and we'll do that right now.
Welcome to the 2018 Infoway Partnership Conference. Innovation is a pillar of the Government of Canada's vision for a modern healthcare system. Digital innovation, in particular, has enormous potential to improve how Canadians access the healthcare they need. In 2017, our government provided Canada Health Infoway with $300 million over 5 years for digital innovation projects in healthcare delivery. Since then, Infoway has advanced its electronic prescription service and invested $70 million into Access Atlantic, a groundbreaking digital health initiative across Atlantic provinces. Comme ministre de la Santé, je suis très fière du travail.
As Health Minister, I'm very happy to what we've done up to now. Future possibilities always encourage me. Working together, we can contribute to improve the efficiency, patient safety, and increase access to service. It's good for everyone, healthcare professionals, patients, government, and innovators. I transmit my best wishes at this conference. I'm sure that your discussions will translate in innovative approaches, will change the offer of health services to all the Canadians.
And finally, I would like to call on Monsieur Richard Audet to the stage. Monsieur Richard Audet is the Associate Deputy Minister of Health for the Minister of Health and Social Services in Quebec, and he's going to give us a welcome on behalf of the Quebec government as well. And I should say Richard is a very active and contributing member of our board of directors as well. Richard, merci.
Merci, Sheila.
Thank you, Sheila. Canada Health Infoway President and CEO.
Of the organization committee, distinguished guests, dear colleagues, ladies and gentlemen, it's my great pleasure to welcome you to this two-day Infoway Partnership Conference taking place in Montreal. Driving access to care, this conference maintained has been the driving force of all jurisdictions in their efforts to transform their healthcare system by using information technology. Such a transformation raises important issues and brings several challenges. Comme bien d'autres juridictions, Québec...
like many other jurisdictions, Quebec has decided to change its health system. This change is built around two goals: to improve health services for patients. We want to offer better quality care at the proper moment, according to the patient's clinical state. The second is to improve the performance of the health system as such, and we want to make information more accessible to have a better management of the system. We want to have a better performing system and offer more services to more patients. Such a change can't be done without the participation of our citizens, who are the main players. Their cooperation can exist at several levels, but mainly two things: a greater involvement of citizens in taking care of their own health, to maintain good health habits, and to prevent illnesses and diseases, and to better follow chronic diseases. The participation of citizens to our data is essential. The citizen becomes an important source of information that couldn't be obtained otherwise. Secondly, we're relying on the concept of patient partner. We want a greater integration of the patient and his families and friends throughout the clinical stay of the patient. This should allow the citizens to make some free and enlightened good health choices. The patient is at the heart of the clinical team's concerns, and the patient becomes a full contributor to the improvement of their health and to maintaining their own healthy health habits. In the past few years, our organization has changed somewhat. We made some regroupments, there were some mergers. What we hope finally is to have integrated health systems and in service delivery. So today we're talking of integrated health and social services centers. These major centers have the responsibility of offering services to all citizens with the full range of services. To sustain the transformation of our health system, the ministry and its network have taken a technological turn. We need technology, and our orientation is based on the idea of a unified health system. It flows from the vision which puts the citizen at the heart of our health system and of our social services, as well as the people he interacts with. So this strategy involves many specific actions which reach three major targets: to offer clinical systems on the administrative level and on the clinical administrative level. The idea is to simplify our clinical systems and to promote the circulation of information and to make the citizens stay in the health system more fluid and transparent. Citizens everywhere in Quebec should have access to their health information at all times and in all safety. This last goal contributed to put the center at the heart of our health system. The privileged means to attain this goal is the introduction of a simple online service which is safe and which is called Canada Santé Québec. The citizens use their health scorecard to enter the health service where they can have access to their data in our archives, and they can also have access to an appointment with a family physician, and so on. I won't go any further. I'll let my colleague Norbert Segal to explain this more in detail. You'll also be you'll also have a demo. So the implementation of our plan is based on cartographies, processes, and data. The standardization we're doing right now will harmonize clinical and administrative procedures. Our first today we started doing the roadmap with many of our institutions, and we're concluding this map of our process and data, and we'll base all our transformation and the digitalization of the health system on this. We should be having some early reports, notably business architecture, which will clarify the citizen's health journey from home to the return to his home, going through the various levels of the health system, which will better manage his clinical condition. This architecture will also define the data required to support the patient's journey, as well as the IT systems required. In the second phase, we will focus more on specific types of care and journeys. We collect this data once by citizens of our health professionals, and they are afterwards consulted by clinicians, researchers, and patients themselves, depending on the context. Standardization means that we'll have to make a wise choice of a judicious clinical approach towards clinical administration. All this work is aimed at one thing. I give you a bit to better serve our citizens, whatever their journeys in the health system. We want to avoid the patient having to give the same information all the time. We want the most updated information wherever we are in the process or in the health system.
And it is facing in the transformation of its healthcare system are the same as the one faced by other jurisdictions. From our experience, we are convinced that even though this transformation requires important efforts, and no matter how difficult it may seem, it is worth engaging ourselves in reaching the goal. How? By staying focused on setting the path, establish the target, and keeping them no matter what. But to get a clear view of what we have to do to reach our final objective, we need to consult with colleagues and experts. So let's take the opportunity of our presence here in Montreal for the next 2 days to understand these important issues. Let's discuss them among us and with experts, and let's find effective solutions which can be quickly be implemented to generate more benefits for our citizens and health practitioners. Your active participation to this conference is invaluable to make this event a success. I'm sure you will have a fruitful and rewarding exchange in the next 2 days. I wish you every success and with this conference. I look forward to learning about the outcome. Have a good conference. Thank you.
Merci, Richard. We are very fortunate to be in
Thank you, Richard.
Amnes Santé that Richard spoke about is an excellent patient portal, and it's just sort of leapfrogged, and the numbers are just astounding in terms of how much progress they've made in such little time. So we'll look forward to hearing about that.